Good morning, good afternoon, good evening, namaskar. Hello, everyone. Good to see. Very happy to see you and talk to you and again meeting you. And more happy if we see us and meeting us in person. Good, good. It's always very exciting to see everyone like waiting for this class, like how we are waiting, when to start and when to next, what next. So it's really great inspiration and motivation. It makes us more happy. By any chance, if anyone has something to say, maybe while applying this knowledge, information to your friends, to your helping some family members or someone in the client or anyone, and maybe you have seen this some good result, good change, or maybe finding or experiencing some challenge, something. Yeah, please, Robin.
Yes, so after there, I think on the Sunday call, somebody had mentioned that they were in either India or Nepal, and they had an incident where they were crying, and Dr. Giovanni came over and pressed on the forgive and forget really hard. And it occurred to me with those specific things, because when I had been pressing the forgive and forget, I had not been getting, I hadn't been finding a sore spot in quite a while. And so I decided after that incident, I was going to specifically do the white frame with what I wanted to clear out with one of the kind of just challenges around me making money with my business. And all of a sudden it was like really intense. And I'm like, whoa, this is kind of interesting. So later that morning, I wound up talking to a person and telling her about that. And she's pushing the point. And she's like, I'm not feeling anything. And I tell her about the white frame and putting in whatever you need, the person you need to forgive or whatever. And all of a sudden she's like, ouch. And she turns out, so her mom had passed away at the end of December, and she has been really resentful of her two brothers and how they treated her mom. One of them treated her mom before she passed, and then dealing with the will and all of this stuff. And so she put them in that white frame, and all of a sudden the intensity was huge, enough that she exclaimed. And so I just wanted to kind of share that when you use it for a particular thing with the white frame and with what you're wanting to clear, it can be very powerful. And all of a sudden, I mean, she was not believing me, because she couldn't find a part that hurt until she did that white frame thing.
Very good, Robin. Nice sharing. Very useful and important information. Many of us need, or many of our clients need, this marma, forgive and forget. Many times we recommend and suggest. But it is very important to do this marma, or not only this marma, but any marma point, right point to press, right way to press. Then only we get the result. The marma is all about removal of the blockage and to channelize the energy through. It happens only if we press the right point. It's not to press hard, but to press right point, and then feeling hurted Normally, it should not hurt, but the hurting means there is some block. The more intense hurting means more deeper and bigger trauma. Very important. So, and this creating the white frame, helping a lot to get that point right way, clarity, more deeper cleaning. Very good, very nice information. Thank you. Yes, anyone else? Anyone else has something to say? Good. Some experience, some challenges, some difficulties, or maybe some while doing or following this challenge activity or anything. Maybe just simple home remedy. Yeah, Ilke.
Last week, I had a client with really hard shoulder pain, and she went to her doctor, and the doctor mentioned, oh, there might be an inflammation in this, and you have to take antibiotics, and we can do an injection or something. And I said, okay, let's try something. I don't know it will work, but I try the shoulder murmur. And I did all the points like you told us, even the point under the arm and everything. And I didn't even trust myself because I thought, oh, I don't know if this really will work, but I just follow the process. I will do it. And she left. She couldn't feel the difference at first because it was most of the time when she was pushing something. And next days she sent me on WhatsApp and said, oh, it's more than 40% better than before. And she's not taking any painkillers and it's working. And now she's coming on Monday again and we'll do the second. And I was really happy and grateful.
Wow, wow. That's great, great, great sharing and confirming that this works well. This boosts our confidence. When you see one experience, it helps a lot. Good. Maybe anyone else has like an experience similar like this or something different. Yeah, Mari.
Well, I am receiving, how do you say it, a magazine, medical dossier, and they do their best to tell about their experience. But I'm so glad that we have those videos from all you doctors for inviting and explain about the doshas and the food, because it gives you more strength. And it's so good that you told us not to be too severe because it's getting stress for the people. And some people are really doing everything and some begin with, oh my God, but I want to enjoy life. I say, if you want to enjoy life, it's better to do less of everything. One big problem, a challenge for me to solve is now to have the patience to go with them and say, let's do it 1 month and look at the difference. Because as you can see, here stands prostate cancer. Yeah.
Wow.
Prostate cancer, fighting it, handling it. And then they come with, yes, but tomatoes are good. And now you're telling me not to have tomatoes. And I'm doing so well on salads. And now you're going to explain. I said, I will take it careful, step by step. Salads are cold. This, you have to maintain the internal furnace, the acne. And then they say, okay, I'll give it a try. And then you have to be so patient to say, thank you, because use good words. I am talking to you like one half year. And now you finally say, I'm going to do what you advise. I say, just give it a month. But tomatoes are one big problem in Holland. Tomatoes, cucumber, salads, because that is what the people learn. That is healthy, that is safe. And yeah, I'm glad that we all support each other. That you think, oh yeah, with this one, I have to be careful, not too severe. Please, please, careful. But that is a challenge because I read it in the papers, I read it in magazine, and I heard it from my doctor. Tomatoes are good for me. Then you have to be, and what about pineapple? And what about grapes? And you're taking all that off me. Think, no, look what is left and try to be creative. Okay, then you have to help me and say, yes, few people do on their own. Now I have some time to start all over again. But it is so, I'm so grateful. We had a meeting with Dr. Pujal Lenkers. It was only, yes, last night.
Yeah.
And then you have the, how do you say it? The stimulants again to say it is good to go on and don't give up and don't get disappointed because, as they say, truly, my God, I want to, but it is such a switch, such a turn in my head. It is a confrontation, and you have to take that all and say, it's okay, we'll do step by step. And then they calm down and say, you will walk with me, say, walk with you through the path. Okay. But you, it is also very nice to see that you have to get your information on order and skip what is very necessary at that time. Food, a possible safe that you must be able to open, otherwise it stays safe and you can still die because you are not nourished. Then the ability from the body to do something with it, then you have to explain again, you're taking it out in parts and making your thing of it. If that acne is okay, if that fire is okay, and then you have less, and you don't have to clean so much garbage. Okay. Now, and so you go step by step. I thank you all. Also, Cornelia. It's very good to have a recap and the less information you have, and then you take out what is needed for that client. Some can understand a lot and some can understand just little blocks. So you have to cut it like for a baby. You don't give them a bread or a whole cucumber or something they may eat. No, you don't feed the babies cucumbers and bread, but you have to divide it and make little pieces. Thank you.
Yes, it's a very true that many times we've experienced this same challenge. Many people have like a understanding that the tomatoes or lemon or this or that are really good. Why we are saying no for? Always, it's a big challenge. Sometimes even with the yogurt, the same thing. It has it's a good natural probiotic. Why not that? But when we see in the depth, we understand the philosophy. Why not? Then it helps, and we can give them step-by-step experience. And that is what very important always, that we recommend to go and suggest diet plan to make changes little by little, not lot together. Let them to have some positive experience by their own. Good. Thank you. Yes, Alicia.
Hello, Dr. Hermang. Hello, everyone.
Hello. Good.
I'm glad Marie brought this up because I do think that this is a common issue that people might be having with introducing people to a dietary change. And I was wondering if there is a cookbook that would be easy to follow, that would give them a sense of more variety so they don't panic and feel, oh, I'm limited, but I don't know what else to do. I find for me, that's the biggest challenge I'm having with getting people to change their lifestyle. They feel they know what not to do, but not what to do. And they're not excited about cooking. So having a cookbook or some reference might be nice for them to know what to get excited about.
Good question, good point. And I like this point, like to mention about what to do and what to follow, what to eat, rather than talking about what not. Talking always positive makes a big difference. And yes, we'll have many recipes available in this like a 2 months of vacation. We are working on that, and we will upload as many as possible videos, otherwise as a document for sure. So in these 2 months, we are working on that. We have the subject in the topic, like in the pipeline schedule. We will work on. Good, good. Thank you for bringing this point. Nice. Yes, David.
You hear me? I just want to say,
Yes, we are excited to hear you.
I was yesterday on a student party on a birthday and have done pulse reading.
Oh, wow.
Yeah,
Wow.
so with 3 or 4 people. Like after a couple of minutes, there was 5, 6 people around me, and yeah, and I explained them Ayurveda, and I literally light up. It was so nice.
Nice.
Yeah,
So good, good,
I'm grateful to be here. It's amazing.
great. And how was your experience when you took the pulse?
Yeah, good. I mean, it was interesting. I mean, I could feel a difference and explain a bit, but I still need more practice.
Nice. Good,
Yeah.
good. So keep on doing this. And yeah, it's not necessary that you need to give them recommendation, but just have
Yeah.
practice. Have like that will help. More and more practice will help to boost and develop your confidence in the perfection. More sharpen your quality and skill. Good. Appreciate. Nice. Yes, Afsane.
Oh, hello, hi.
Hello.
I'm very excited because we had a beautiful meeting with Dr. Mira, and I'm very, very happy and very grateful that I spend every other Saturday in Dr. Mira's clinic, which is amazing. I have a couple of questions, if you don't mind.
Yes.
One is I did 3 knee dharas at work, and I bought black garam flour, but somebody had worked through it in the bin because I'd forgotten and I left it at work. Now, yesterday I was looking for garam flour because I have bought a couch. Part 6, the couch is here and it's pink in color. I sent you the picture of it. They're going to come to my house and we're going to practice the Dara, the knee Dara, the heart Dara, and also hopefully pulse reading on each other soon in the next Jubilee holiday. And my question is, for the knee Dara, for the heart Dara, I understand that before we do the Dara, we have to remove toxins, but we are just going to practice. And Dr. Smita, in the video for pulse reading, she said you can do the heart Dara even before you do the toxins. Yes?
Yes.
And she said we don't need as much oil. Now, I bought balada oil, and Dr. Mira said we can use things like olive oil and sesame oil as well. For the wall that we do, for the dough, for the flour, can we just use garam flour? Just garam is called, or gram flour?
Yeah. The reason, what is the reason behind to use the specific flour?
It's because
Why
we want it to bound properly and stick to the skin.
Yeah, exactly. So the idea is only that it has nothing connection, no relation with the effect of the treatment. It is only just to stick with the skin. Okay. So not to have a leakage of the oil or the things whichever we pouring inside.
So the oil doesn't get absorbed into the flour
Absorbed
either.
and not getting out.
Okay. And the next question that I have is about Basti, because I wasn't in India, obviously, and everybody's talking about different Bastis and the enema. What is the ingredient of the enema? Can we make it at home ourselves?
Good question. So Sorry, before answering this or responding to this question, I would like to mention something about the previous topic about the hard dara and other
Yes, thank you.
treatments or any other treatments. Yes, normally there are the specific formulation to use for each and every treatment. Specific kind of the combination of oil and ingredients are there. But in the absence of those specific formulation or ingredients, you can use whatever like a kind of the oils available with you. Example, as you mentioned, like olive oil or sesame oil or any. But normally there is a specific in like a formulation. And maybe some of you like who were here in India, they had like they may have this special hardara material or chirodara things and ingredients formulation. So that is one thing. Now this hard dara, sirodara or other dara, knee dara or any treatments have one common standard formulation which can be like for any knee patient, any person who has the knee problem is the same.
Yes.
Where about the bastis, it's an individual, customized, more specific, more precise,
Okay.
depending on the concern, depending on the other health challenges or other health conditions, what are the things are and what is the focus and concern to give the basti. So if it is general basti, purpose general cleansing, then maybe there is a one basti available ready. It's again the mixture of the couple of tablets, couple of the ingredients, all, and plus the oil and growth. So first we have the powder of tablets, the powder of the herbs. We boil it in the water and prepare the decoction. Then we have a specific combination, specific formulation of oil and ghee, specific mixture of oil and ghee. We add in that decoction and then we give the basti, means enema. We have a one standard cleansing basti, detox basti available. Very soon we'll have all the bastis for the different purpose, for arthritis, for diabetes, for asthma, for skin, for autoimmune condition. Like this, we'll have specific disease-wise bastis ready available. Right now, we have only one basti ready available. Good.
Yes. So when you said we powder a herb, for example, amrutadi, if we powder it and boil it in water, would that work? Or is it not?
So, sorry, say again.
You know, you said we have to powder a herb.
Yeah.
And then boil in water.
Yeah. So we
For
have
example.
that. So we have that powder, ready-made powder.
Oh, I
powder
see.
Of ingredients, powder of herbs.
Yes.
And that we mix like with the water and boil it. And prepare the decoction. And then we add some oil and ghee. And then we give the basti.
So we cannot make it ourselves. We can't mix things together.
In certain situation, yes, you can make something. Yeah, depending, like if you list out you can just mention what are the concerns to focus. Accordingly, couple of tablets, we can mention that this, maybe you can have. And you can start with at least.
Yeah, so now in UK, because of the pollen season, many people are coughing. There is a lot of phlegm. There's a lot of like serious cough around, even my students, so everybody's coughing badly. And I was just thinking, I wonder if there is any particular basti formula that we can kind of do ourselves. I know licorice root boiled in water to drink it and drink it and drink it and drink it and then keep throwing up is good for lungs. Yeah. Which Dr. Mira kindly shared with us. Yeah. But about basti, I don't know.
Yeah. So this normally this kind of the pollen allergy or spring season, the people are facing this condition because of the low immunity. So there is some specific kind of the ingredients like Augus, Immuno, Virophyte, Jivan Yog, Asthalok, Divya
I have
Swas,
all of them.
Jivan Sakti, Suruday, Amrutras, and each 5 tablets of each. Crush, make a powder, and then boil it in water and add some waka oil in that, and then give
Did
the
you say, pardon me, did you say 5 of each of these tablets?
exactly.
5 tablets? Uh-huh.
Yes, yes.
Crush and boil.
Boil in the water.
How much water?
No water. So 400 ml water to take,
400 ml.
and then to take
And
oil
add
in
waka
ghee.
oil.
Yeah, waka oil, 30
How
ml,
much waka oil?
30.
30. 30,
Some
yeah.
vatak oil,
Yeah.
20,
Oh,
and some balada oil, 20. So total 70 ml oil in this, and 400 ml of decoction. When you
yeah.
boil it, that water becomes 330 ml out of 400. So 330 decoction plus 70 ml this oil, and then you give this basti when it is like a body temperature.
Wow. Thank you.
It's good, good.
Thank
Nice
you.
question, and it is very useful and effective.
Thank you very much.
Good, welcome, nice. Yes, Jen.
Hi, good morning or
Good.
evening, or wherever you are, everyone.
Yes.
So there's some question about, if you don't mind, going back to the white frame versus the red frame in the chat. And with the forgive and forget, should it be the white frame or the red frame? And if you could just clarify, if that's okay, a little bit of the proper usage of those. So just, there's a lot of questions in the chat right now, so.
Good, good. So normally we ask person to close the eyes and to create a white frame in front of the closed eyes, like here on this side. And maybe to create a white frame needs sometimes some minutes. They will see only the white frame. Just in the closed eyes, they will see the white frame. It needs to create. Sometimes if it is difficult and impossible, then we ask them to create the white frame here on the third eye. They create, they see it, they visualize it in a subtle way. And once they start seeing only white frame in front of the closed eyes, then we ask them to put and think about the thing which is disturbing, which could be the reason as an emotional trauma. Could be, not necessary. They don't know, because many things could have happened. So one of the things they can think about the most like a possible reason or cause. And as soon as they see, yes, I am seeing and I'm thinking, and then visualize those moments in the like a childhood or a young age or whatever, and then we ask them to start doing this, pressing this marma point, like this, if it is about the forgive and forget, then immediately they will feel intense hurting or intense like experience. And then they need to continue follow the marma as 6 times 6 to press, and that will help step by step, slowly releasing and relieving the trauma.
So when then is it appropriate to use the red frame? Because that's kind of a little bit of the confusion on, you're using a red frame if you're doing that when it's something that you do not want, right? So what would an example of that be?
So whatever something you want to forget or forgive, that kind of the things you need to. And sometimes see people, many people coming and saying that, oh, I don't remember if I have some trauma or not. Maybe they have forgotten already. So there is no need to remember it. If they have already forgotten, it's good that half work is done. Anyway, we are working for the forgive and forget. But in that case, they need to just press this point, follow this point 6 times 6, and slowly and gradually they will experience the positive change in their life. I would say like maybe 50% of the time people don't remember the trauma.
Right.
Only
Okay.
50% time they remember. So it is good if they have already forgotten.
Thanks.
Good, good, very useful. Nice. Yes, Lisa.
Hi, good to see you again.
Yes.
I have a new client who has come to see me recently, and she has a lot of discomfort. It's not acute pain, but it's discomfort around the liver area. She had her gallbladder removed several years ago, and this discomfort's been going on for her for about 8 years. So I highly suspect she's got something going on with the liver. And given some of the things she's told me about, where she's had negative responses to a lot of the flu shots and different things she's had, and in most recent being some of the COVID vaccines, I highly suspect she needs to clean out the liver from all the heavy metals. What's the best approach to that? Because I've got her on mung bean soup right now. We haven't yet set up a meeting with the Vaida, but any recommendations?
Yes. So good. One common thing to work in this situation is a detox tea.
Okay.
The recipe of
Just
the
a minute,
detox tea
Rohan.
is cumin. 1 teaspoon cumin seeds, 1 teaspoon coriander seeds, 1 teaspoon fennel seeds.
Okay, hang on. 1
Boil it
teaspoon
in the 1
cumin,
liter of
coriander,
water for
fennel,
5 to 7 minutes. And then
oil.
to keep it in the thermos so it remains warm. And then to drink it little by little throughout the day.
Okay.
In some cases, we ask to add dry ginger powder, but depends. Normally in this type of, when you are not sure, just give this like cumin, coriander and fennel seeds. That's it.
Okay. Not powder. Has to be seeds.
Seeds, yeah, more effective. And to keep it, not to stain it, keep this seeds in the thermos. Let it be with the water throughout the day. So we'll get the more and more effect from these seeds. End of
Okay,
the
now when
day,
she drinks it, is she going to drink
Good.
it and eat the seeds?
if she's comfortable, she can drink and chew and along with water, or not comfortable, end of the day she can throw, but at least to keep it in the water throughout the day.
Okay.
So this is the one best effective home remedy as a simple thing, and in few days she will start feeling difference, but provided to do at least some changes, to make some changes in the food. Basic,
Yeah.
only few things, not much, and not necessary to stop, at least to reduce by 50%.
Yeah.
White
I
sugar,
recommended, yeah,
wheat,
white sugar.
meat, sour things means vinegar, lemon,
Okay.
oranges, lime, and yogurt. If you ask them to reduce or stop whatever easy or possible, and
Mhm.
to give this detox tea, that's it to begin with, and then to go on. And then in future, when she's ready to like go to the next level, more deeper, can have like some Ayurvedic herbs to add in that, like Leuton, 2 tablets 2 times, Toxigo, 1 tablet 2 times, Virachin, 2 tablet before going to bed.
What was the first one you said?
Leuton,
Oh, Livtone. And how much would
2
she take?
tablets twice a day.
Okay.
After food,
And
Toxigo, 1 tablet 2 times a
One.
day, and Virachin, 2 tablets at night before going to bed.
Okay. Okay. No, that's excellent. Thank you. I appreciate that.
Good, welcome. Good, nice, nice. Yes, Susie.
It's so wonderful to be here. All I have to say is it's just amazing. I have 3 potential clients, and yeah, I'm just going to say this because of the job that I work in, because of HIPAA, I cannot say anything to the people that I work with, and they are the ones that need it the most because I'm working with seniors. I mean, it's just devastating to watch these people and not be able to say anything. So I'm not quite sure how to work around it, but it's just very sad. I just want to, you know, I'm not in any position as a non-medical person. I can't say anything, which is, anyways, I have one woman and she's actually a hospice nurse, and she has type 2 diabetes, and she has lupus. And she had to do the vaccine because she's a nurse. And her lupus has been reactivated. And she does not know what to do because there's nothing in the Western medicine that is able to help her. And she feels awful, and she's extremely tired. Now, I've shared a little bit just through a conversation, not with the patient in the room. And yeah, Jane, I don't know if I can give a copy to the clients because of HIPAA. I don't know. That's a good question. I might have to ask my administration. I don't know, my admin. But I wanted to know if there is a MARMA and a home remedy that I could give to her that she could use immediately while she's thinking about doing something new.
So here in this case, we recommend immunity tea.
The immunity tea, okay. I have that recipe.
Perfect.
Okay.
As
And
a
is
home
there a
remedy,
MARMA form?
give this home remedy, and as a marma, the 7 number point to press on the right hand.
7, okay.
7 number point on the right arm. Okay.
Okay.
7 number from the wrist.
Yep. On the inside, not the outside, the inside of the
Yes,
wrist.
inside.
Okay,
inside.
yep,
Yeah.
I'm familiar. All right, so
Perfect.
my next person, which I kind of wrote in our 9 path, you know, our nine group, is a person that I personally know, and she, when she got pregnant, she got eclampsia, and she is now suffering from stage 3 kidney disease. And she's been, and I've just recently met her, and you know, we're forming a friendship and getting to know each other. And again, is there, and I actually have given her a book because there's no HIPAA involved with this. Is there again a quick, not a quick, but you know what I'm saying, a home remedy that she could use and a MARMA point to help her to start doing something right away while she's reading the book and talking with me and figuring out, you know, what she wants to do.
So in her case, as again, like to work on the immunity first.
Okay. Okay.
to begin with the immunity, so we'll get the better response. Normally, to remember one thing, like when there is a complicated situation or the person who is having like a many health challenge, normally we can imagine or guess that his or her immune system must be down. And that's why no treatment is helping or working or functioning or giving the benefit to them.
Mm-hmm.
So once, unless and until you don't increase or improve or strengthen the immune system, even our treatment won't help or work.
Okay.
So
Gotcha.
before giving any recommendation as basic principle or philosophies to strengthen the immunity, work with this, then automatic with the by having a better immune system, their prana, life force, limbs energy will strong enough. Automatic, you will see the change in their energy level. Energy doesn't mean the strength, stamina. Energy means the brightness, power, the visual energy.
Gotcha.
If you can feel from the face.
Okay. All right. And my last one is a young woman who has a couple of kids. She just had twins and she is suffering from postpartum depression, and it's very severe. Western medicine is not working for her, and their family is very concerned for her well-being because, as we know, when you get to this stage, women are not in their right mind. There's something really, and they can do something very drastic. And so the family is really concerned. Again, I was wondering if there was a marma point to help with the emotions and the mental state that she's in, along again with a home remedy.
Yep. So again, this 7 number point,
Okay.
working as like a against the depression, anxiety, panic condition, restless, anything.
Okay.
7 number point. It works as
Okay.
an emotional support marma.
Okay. All right. Thank you.
Good. Nice. Thank you. Thank you all. So now we are waiting for Dr. Kamal's session. Now it's time to start. So I invite and I request Dr. Kamal to take over.
Yes. Good evening, everyone. Good morning. Namaste. So we will start with our session today, which is about maintaining the equilibrium of health. Before that, I would like to bow down in front of Lord Dhanvantari, seek the blessings of the masters, the Siddhaveda lineage, Pankaj Sir, Baba Ramdas Ji, Smita Madam, and all the great masters, my Guru, Sadguru Veda Bharti Maharaj. And we will offer prayer to Lord Dhanvantari first. धन्वन्तरे गरुचि धन्वन्तरे ऋतरु धन्वन्तरी भवसुधा भान्वन्तरावसथमन्वन्तराधिकृत तन्वन्तरौषधनिधे धन्वन्तरङ्गशुभु धन्वन्तमादिषु अवितन्वमाब्दितनया सुन्वन्तकात्मरुद तन्वन्तरावयव तन्वन्तरात्रिजलधौ ॐ चन्द्रौघकार्तिममृतात्मकरै जगन्ति सञ्जीवयन्तममितात्मसुखं परेशं ज्ञानं सुधाकलशमेव च सन्दधानं शीतांशुमण्डलगतं स्मरतात्मसंस्थान् अज्ञानदुःखभयरोगमहाविषाणि योगो यमाशु विनिहन्ति सुखं च दद्यात् यन्मादविभ्रमहर परतश्च सान्द्र स्वानन्दमेव पदमापयति स्म नित्यम्। ॐ श्री धन्वन्तरये नमः. Yes. So with this, we start with our session, which is a very interesting topic about what is Svasthavritta, what is Sadvrutta, that is the code of good conduct, the importance of Sadvrutta, implementation of Sadvrutta, and disorders caused by not following the Sadvrutta. Before this, I will just tell a quick story about what this topic is all about. In all the previous sessions, we were seeing now also the question answer session initially, which was going on. So it was about, asking remedies, seeking remedies for different kinds of clients and everyone. Today's session is about ourselves, is about going within, is a journey that is inside, and what it is all about. So let me start with a story that I think many of you must have heard about it. So there was a saint who and his disciples. So the disciple, he was building a very tall statue. It was a really very tall statue, like, the Statue of Liberty or something. And the statue was being made by one of the persons or disciple, and he was making the statue, and there was a little finishing work that was remaining on the nose of that statue, and it was something that was very negligible, which no one could have even recognized, and he could have got along with not even doing that detail. And all the other people said, let it be, why are you doing this? It's just a small thing, nobody is going to even see the nose. It's such a long statue, tall statue, and nobody is going to see it. Then the person said that I don't care whether anybody is going to see it. I know that it is not done, and for me that's enough. And today's topic, Swasthavritta, is about ourselves, how we are, that we know very well rather than others. So it is about how we are, what is our real self, and how should it be. And before becoming a Vaidya or even a human being, everybody needs to follow this Swasthavritta. And this session, I am just someone who is sharing this. I am not teaching it or anything. I am just a medium from the scriptures to all of you. So we are all in it together, and I'm just sharing whatever is there, and it's not kind of a teaching or anything about Swasthavritta. So we will start with this beautiful topic, which is one of the most, I think, essential and necessary in our day-to-day lives as human beings, as doctors, as clients, and anything. So let us start with the session. Yes, next slide. So before that, let us just recollect the objective of Ayurveda. The objective of Ayurveda is, here is a Sanskrit verse which says, Prayojanam chasya swasthasya swasthya rakshanam aturasya vikara prashamanam cha. So the main objective of Ayurveda science is to maintain the health of people by preventing the occurrence of several disorders and also treating the various kinds of health problems. So here we have to remember that there are two objectives. One is prevention of the disorders and the other is treatment of the disorders. So in order to remain healthy, today's session is about how to remain healthy. So one of the very essential parts to remain healthy is to follow the Swasthavritta that we are going to learn today. Next slide, please. So yes, Swasthya Rakshana, here we can see the prevention of different kinds of health issues. How we can not get diseased only. There is no disorder. How can we remain healthy in a perfect balanced state? So first only we will start with a very interesting case study here, which is about this client, Rajesh. So when Rajesh, did not have any major health issues, still he prefers to do the detox in Ayush Shakti on a yearly basis, whenever his schedule permits. Because detox is not only for the disease, it is also to remain healthy and to prevent the occurrence of several kinds of disorders. So this is a very interesting case study of this client who did a detox on a yearly basis to prevent, several kinds of health disorders. So what does it do? So it is written here that it services our cars to maintain its function and increases longevity. And Ayurvedic scriptures, they also recommend that to do detox from time to time, and so that we can maintain our body functions and the quality of life. So always, not only the quantity, not only the longevity, but also the quality of life matters, which can be maintained with the help of the detox. And according to Swastha Vritta, now what is Swastha Vritta? Swastha Vritta means how to remain healthy, the science of remaining healthy. So there is a branch in Ayurveda which is completely devoted to Swastha Vritta, about how to remain healthy. And today's session is one of the parts of how to remain healthy by following the Sadavritta. So this client, he did periodic detoxing, and it helped to remove the toxins that were accumulated in his body. And whenever he used to come to the clinics, the Ayush Shakti Vaidyas examined and studied the clients. And we also do it for a number of clients in Ayush Shakti, wherein to prevent the different kinds of disorders, a customized detox program is planned according to the Prakriti, that is the body constitution, the family history of health issues, and the stress level. So there are various factors on which this detox program is planned or customized. And after detoxing, this client, Rajesh, he felt better, change in his weight, and most important, his energy levels and overall body functions and the productivity of his mind improved drastically. So this is an interesting case study where it is emphasized that detox is not only to treat the different kinds of disorders, but also to remain healthy and prevent the occurrence of several kinds of disorders. Next slide, please. Now here again, we will recollect, we have learned this earlier, the signs of good health, which are samadosha samagrishcha samadhatu malakriya prasanna atmendriya mana swastha ityabhidhiyate. Now when we are talking about how to remain healthy, or about health, first of all, let us recollect what the good health is all about, which we have learned in the previous session. Samadosha, that is balanced state of the three doshas. Sama Agni, the balanced state of the digestive fire. Samadhatu, that is the balanced state of the 7 tissues. Samamala, that is the balanced state of the 3 waste products, that is the feces, urine, and sweat. And Samakriya, the proper and efficient functioning of the body, mind, and sensory organs, and everything. And the very important is prasanna atmendriya mana, to be happy from the soul as well as the sensory organs, and the mind should also be happy. So when all these signs are present in an individual, we call that individual as healthy. And if you want to achieve this state of health, then as just now we saw, detox and various kinds of herbal remedies, they help in achieving this health. Next slide, please. So Vikara Prashamana, this is another objective, that is the alleviation of the health problems. Now in all the sessions before, we were seeing about clients who had several kinds of disorders, and how they got healed by using the different kinds of herbal remedies, the detox procedures, the home remedies, Marma points, and everything. And also the question answer session that was going initially, it was all about vikara prashamana, that is the alleviation of the health problems. Next slide, please. Today's topic focuses on swastha vritta, that is, swastha means health and vritta means the regimen or how to follow the swastha vritta. And here there is a very good definition of what is swastha vritta. This shlok is given here, which is Taccha nityam prayunjita swasthyam yenanuvartate ajatanam vikaranam anutpatti karam chaya. So here the word swastha means healthy and vritta means regimen. So swastha vritta means healthy regimen. And swastha vritta is a branch of Ayurveda science which prescribes the theory and practice of the maintenance of public and personal health. And swastha vritta deals with the state of health and the regimens to be followed to keep oneself healthy. And what it is, what factors it contains? So it contains to follow a healthy diet and lifestyle as a daily routine to maintain the health and also prevent the future health disorders. Next slide, please. Now, here we see the title as Swastha Chatushka. Here, Swastha means health and Chatushka means a group of 4. So we can see in the bracket, Swastha Chatushka means 4 health components. And these are mentioned and described by Acharya Charak. So Acharya Charak has explained the 4 components and he has called it as Swastha Chatushka to remain healthy. And which are these if we want to achieve health? First one is Na Vegana Dharaniya. This we have learned in one of the sessions about the suppressible and non-suppressible urges. Second one is about Sadvritta, that is the code of conduct or good regimen that we are going to study in today's session. Dinacharya, that is the daily regimen. What are the daily things that we have to carry out, the daily activities? That is all about Dinacharya. And the fourth one is Rutucharya, the seasonal regimen. According to the seasonal changes, the diet and lifestyle also changes. So these 2 topics, Dinacharya and Rutucharya, we are going to study in the immediate next session. I think it is on 4th June. So today we will study about Sadavritta, that is the code of conduct to remain healthy. Next slide, please. So here again, first we will see a very interesting case study about Wilfred Fernandez. This client, Wilfred, had an enlarged prostate and he was advised to do surgery. So frequent dripping and unsatisfactory urination were his major concerns. So when he came to Ayushakti, the Ayushakti Vaidya consulted with him, examined him and learned his history of suppressing his urine. As we have studied, if urine is a non-suppressible urge, and in his case, what was the factor? He was suppressing his urine. So that was the positive factor. And why he was doing it? Because he was too busy or having many meetings and he was holding his urine for long durations. And this was causing his dosha imbalance and mainly vata dosh imbalance. So he was advised a detox plan, the herbal supplement Prosto and some others also, a diet and lifestyle changes. And after 3 weeks, his symptoms improved 80%. So, and after 3 months, his tests showed that the size of prostate had reduced and there was no need of surgery. So here we study that by suppressing the urge of urine, this was the causative factor in his case, and it was avoided, and he was also given the detox plan and the herbal supplement, especially in his case Prosto, and also the diet and lifestyle changes. So with that, he was able to achieve good results and avoid surgery. Next slide, please. Yes. So now we start with Sadavritta, which is the main topic of our session. So what is Sadavritta? So there are two words. If we just divide the words, there is sad, word sada, and the other word is vritta. So the word sada, it means good, and vritta means regimen. So we can say that sadavritta is about good regimen. Sadvritta is applicable to people of all age groups at all times and at all places. It is to be done by everyone, not only the doctors. It is something that has to be done by every individual. So practicing these codes of conduct wholeheartedly can definitely bring inner peace and happiness. And of course, violating them can make a person angry and agitated. As we saw, the main symptom of being healthy was prasanna atmendriya mana. So when there is inner peace and happiness, then only we can say, along with the other things, then only we can say that a person is healthy. So this sadavritta helps us to achieve that happy state of the mind, the sensory organs, and the soul. That's why it is very essential. Next slide, please. Now, what are the types of sadavritta? So we have divided this to understand it better. So we have divided this into the types: ethical conduct, then the social conduct, the moral conduct, the mental conduct, and the physical conduct. So if we have to describe about the good regimen or codes of conduct, we divide them on the basis of these 5 things. Next slide, please. So first we learn about what is ethical conduct. Now here are some points which are given, and today's session is about self-analysis. It is looking within. It's not about how we portray ourselves in front of others, but it's about how actually we are as human beings. So here are some points about ethical conduct. That first one is always be truthful. To be truthful, always. Having control over the emotions. So having self-control, it is very necessary. Not harming anyone. Not harming anyone means it's not about only it's about violence of all kinds. It may be verbal, it may be physical, or any kind of. So not harming anyone. Then to be free from anger, jealousy, anxiety, and all the negative emotions. Or to know how to control. Better is how to know how to control these negative emotions. So these are the points of ethical conduct. Next slide, please. Now, as I told you, today's session is about looking within, self-analysis. So in this session only, we are giving you a 2-minute evaluation period to everyone to observe and score yourself on a scale of 1 to 5. And how you're going to do it? Next slide, please. So here we see you will get 2 minutes and you just analyze on the basis of this ethical conduct on the whole. And here are some points, for easy analysis if they are given. So it is, I'm satisfied with my performance. First is strongly disagree. Second is disagree. 3 undecided. 4th is agree. 5 is strongly agree. You have to give points to yourself, not to others, to yourselves on these 5, we can say the rankings. And for this 5 points, like truthful, control over emotions, we have self-control, not harming anyone, and everything. So we have to just analyze and give score, and this is only for the self. So for 2 minutes we do this. Yes. So I hope everybody has completed the analysis for the self, and we will move on to the next slide. Now we come towards the social conduct. So after the ethical conduct, here it is social conduct. So in social conduct, to speak properly and nicely with everyone after proper thinking. It's not whatever comes to the mind. There is a way to put things that we all know. So speaking after proper thinking and speaking properly. Then listening also carefully. So that is also very important. The third one is to talk in a soft, pleasing tone. So in the scriptures also, this point has been emphasized in all the scriptures, to talk very sweetly and in a pleasant manner. Even if we do not agree with things, there is a way to put things across. So that has to be followed. And to smile even in tough situations, even where we do not agree or something is not going according to what we wished or we hope, then also to smile. And learning to be tolerant, because things never go according to our wish. Life does not move according to what we want. So it's learning to be tolerant and adapting the necessary changes. So again, next slide. Again, we are going to do a 2-minute evaluation. We will give you a period of 2 minutes to observe and score yourself from 1 to 5. So again, your points I will repeat: speaking after proper thinking, listening carefully, talking in a soft, pleasing tone, smiling even in tough situations, and learning to be tolerant. So again, we give you 2 minutes to do the analysis. Yes. So now we move towards the next slide. So now we will see mental conduct. So first we saw ethical conduct, then the social conduct, and now we are seeing the mental conduct. So here the points are: to keep a check on oneself. Check on oneself means to analyze our behaviors or our thoughts or the way we are interacting. So keeping a check on whatever we say to others or how we portray ourselves. Then trying to understand who we are and what is the purpose of our existence. In Ayurveda, there are 4 purusharthas, that is the dharma, artha, kama, and moksha. And in order to achieve the highest goal, to understand the purpose of existence, it is important to remain healthy. And that's why all these sciences like Ayurveda have been propagated. So it is very essential to understand who we are and what is the purpose of our existence, being self-aware and alert. Then learning the art of detached attachment. Now, what is detached attachment? It is, if something like everybody knows better than me that in life everything does not go as we have planned, or we do not get the things always as according to our wish, but to adapt to things faster and accept the things and move on. That's about detached attachment. And attaining inner peace. So whatever situation we have been put in our lives, to accept it and to be happy and content with whatever we have, because some things are not in our control. So this is about the mental conduct. Next slide, please. Again, everybody is going to get a 2-minute evaluation period to observe and score yourself on a scale of 1 to 5. Next slide. So here are the points of mental conduct. Again, I will repeat: to keep a check on oneself, trying to understand who we are and what is the purpose of our existence, to be self-aware and alert. Learning the art of detached attachment means to let go things which are not in our control, and to attain inner peace. So please do the self-analysis. Yes, now we move towards the next slide. So now we move towards the moral conduct. So here it is about doing good social deeds, deeds that will be beneficial to the humanity or to others, and which gives us joy. So here are the points: helping the poor and needy, then being with a friend or relative in their difficult times, because as we require someone to in our difficult times, it is also the need of others, and we should also be the one to be a friend or relative in their difficult times as well. Attending to social duties, following the rules and laws, in a particular place where we live in, then donating for those who are in need. This point, it is called as dana in Ayurveda, and it is also a very important type of part of Daiva Vipashray Chikitsa, which we are going to study in the 2nd and 3rd year. So donating for those who are in need. When we have something in excess, it is better to give something to the ones who cannot afford or don't have those things. Then following the path of righteousness or dharma. Dharma in Ayurveda does not mean any religion. It means the path of righteousness. So that is the meaning of dharma. And to follow whatever is right. whatever is right is prescribed in. Everybody knows about that. So following that. Next slide, please. Again, we are going to do a 2-minute evaluation period for this moral conduct. And here are the points: helping the poor and needy, being with a friend or relative in their difficult times, attending to social duties, donating for those who are in need selflessly without having ulterior motives or intentions, then following the path of righteousness, that is dharma. So please, in the 2 minutes, do the self-analysis regarding moral conduct. Yes. So now we move towards the next slide, which is about physical conduct. So here it is more about maintaining the personal hygiene and cleanliness, because it is something very essential factor to even maintain the mental health. Cleanliness is the most important factor. So physical and mental health depends upon it. That's why here are some points: brushing the teeth twice a day, then having a bath or shower regularly, then wearing clean clothes, smelling good, cutting hair and nails regularly. It is advised in the scriptures to do it for 3 times in 2 weeks. It's according to the scriptures. Washing hands and mouth after eating, offering prayers to the supreme power in nature every day. That is, we can understand it as a feeling of gratitude and thankfulness about whatever we have. It's about that. Eating on time and the right quantity, which we have already studied in the earlier sessions, and avoiding sleep during the day. So these are some points about physical conduct. Again, we will do the 2-minute evaluation. Next slide, please. So here again, the points I will just revise. It is about personal hygiene and cleanliness, washing hands and mouth after eating, offering prayers to the supreme power who we believe in, or the power in nature every day, eating on time and in the right quantity, avoiding sleep during the day. Why do we have to avoid sleep during the day? Because it leads to the vitiation of kapha dosha and leads to the kapha disorders. That's why it is a part of physical conduct. So we will start the 2-minute time. Yes. So that brings an end to the analysis, the self-analysis, because as I told you that it is about the self. And now what is the importance of this Sadvrutta? We are going to see. So following the Sadvrutta, following the good regimen, the code of conduct, it can improve the overall health and also well-being, and it can give happiness, the real happiness to the individuals. It will also allow a person to respond righteously to life experiences and can instill a sense of purpose in everyone. So what does Sadvrutta do? Whatever we have done just now, what it gives is a detailed knowledge about what to do, what not to do, and also how to live. It explains us the art of living, how to live. And following the code of right conducts described in Ayurveda is definitely highly effective in reducing the lifestyle disorders and to live a healthy and a peaceful, contented life. So that is the importance of Sadvrutta. Next slide, please. And also, as we learn about different scriptures in Ayurveda, the Sadvrutta is a part of all the scriptures because it is advised for a normal human being to follow this code of conducts, and also for a doctor, obviously. So these regimens of right conduct and behavior, it does not only help to obtain and maintain the health, but also to build a most civilized society and nation, so worthy of emulation. So that is nation building, character building and nation building is the main motive of Sadvrutta. And by proper implementation of Sadvrutta, we can prevent the different kinds of physical, psychological, and different kinds of health issues, and also achieve a long and healthy life. So a good quality and quantity of life in terms of physical, psychological, and the social Sadvrutta, and whatever we have just now learned. So this Sadvrutta is an essential tool it has been, and it will be, and it will always be, and now in the modern era also, to prevent and eradicate the root cause of various health problems. So whenever we are advising our clients, or whenever we ourselves, so we have to first practice Sadvrutta. And it is when it is also one thing is here, whatever has been prescribed, we can strive to be like that. The scriptures, what they advise is to strive ourselves, to make ourselves better, to fulfill whatever is prescribed in the Sadvrutta. And mistakes are inevitable part of human lives. As humans, everybody makes mistakes, but to learn from those mistakes and never repeat those mistakes again is what has been advised in the scriptures, and to be a better person every day. So that is the main essence of Sadvrutta. So that can be achieved by striving hard to being better and better. Next slide, please. So here again, we come to the case study of Sandhya Singh. So this client, she was experiencing low energy and loss of interest for any activities, the daily activities in her life. So she was depressed, and her depression was due to the overwhelming responsibilities and expecting too much of herself. So this is a thing which we see, people mostly suffer from. And because of that, her energy levels were also affected. There was no happy mind. That's why she was not feeling well, not feeling healthy. And when she came to Ayushakti, the Ayushakti Vaidyas recommended the herbal supplements, which are Brain True and Bliss, and the Marma Points, a diet plan, and lifestyle plan. So, and her lifestyle advices were based on the Sadvrutta principles. Just now, whatever analysis was done, the same was advised to her. And in 45 days, she showed remarkable improvement. Her symptoms improved by 90%. She felt like a new person and regained her vibrant energy. This case study is a good example which shows that whatever we are facing right now, or whatever, how far even if we are from the Sadvrutta, we can always strive and work hard to make our lives, better and according to the principles of Sadvrutta. And as this client has achieved a remarkable improvement, improving, herself, her lifestyle, her diet, whatever, with the help of the herbal supplements. So she felt she became a new person. So that is achievable by everyone. So little help will always help to be a better person and remain healthy. So that's what this case study tells us about. Next slide, please. So now we move towards Achara Rasayana, the Ayurvedic code of conduct. Yes, next slide, please. So let me first explain what is Achara Rasayana. So we learned about Sadvrutta, and now here it is another part, Achara Rasayana, which is mentioned by Acharya Charaka in Charaka Samhita under the context of Rasayan Chikitsa. So Rasayan Chikitsa is where, all the 7 tissues, the health of all the 7 tissues is restored and rejuvenated. So Rasayan is all about rejuvenation therapy. So we know that we use different kinds of herbs like the amla, the haridra, turmeric, and there are so many herbs, the triphala. So many herbs that we use for rejuvenation. But Acharya Charak has also emphasized on this Achara Rasayan, that is the behavioral rejuvenation medicine. So when we talk about rejuvenation, it is also about the behavior. It is also about how we behave, and it also helps in rejuvenating the tissues in the body. So this is a concept explained by Acharya Charak, which is Achara Rasayana. Here is a Sanskrit verse, which is like Yogayayu prakarshartha jara roga nibarhana manah sharira shuddhanam siddhyanti prayatatmanam. So what it explains is Achara Rasayan. It is a unique concept of Ayurveda, and especially of given by Acharya Charak in Charaka Samhita, that implies to a specific code of conduct, lifestyle, and behavior, which when followed religiously brings about rejuvenation in the body and mind. So it is about the behavioral practices, and one who adopts these behavioral practices is believed to gain all benefits of Rasayan therapy, which is rejuvenation, and it also helps in achieving health, well-being, vigor, vitality, and it works as an anti-aging medicine. So in this way, one can achieve the benefits of rejuvenation therapy just by following a particular conduct and without physically consuming any medicinal substance. So here we have to understand, whenever we are talking about rejuvenation, rasayana, about restoring the health of the dosha, dhatu, and malas, it is also about the herbs and the detox and everything, but it is also about a very important factor, that is the behavior, that is the code of conduct, the lifestyle. So when it is proper, it also helps in achieving the health, and it helps in not only the rejuvenation, but here we can see vigor, vitality, well-being, and so many things, anti-aging and everything. So this is a very important concept. Next slide, please. Yes, a very important and a very beautiful shlok, again from Charaka Samhita, which is Paro bhuta daya dharma iti matva chikitsaya vartate yasa siddhartha sukham atyantam ashnute. Such a beautiful slide, and you can see the pictures of different animals. And here, Bhuta Daya actually means compassion for all the living creatures. It is not only for the human beings, but it is for all the smallest to the biggest living creatures. And compassion towards them is the best dharma, that is the path of righteousness. And a physician who enters his profession with this ideal in view accomplishes his objectives best and is endowed with spiritual and material earnings. In all the scriptures, it has been written and it has been described that the first and foremost quality that a Vaidya should have, that a doctor should have, is compassion. And out of that compassion comes, the, like here it is explained, the spiritual material earnings. They're a very small thing, but there are a lot of bigger things that we achieve when we do some things, or when we try to help the clients out of compassion. So that is the first and foremost thing that each one should have or strive for. Next slide, please. And what very good example of all the shlok and compassion here is the master himself, Dr. Pankaj sir. And we can see Pankaj sir helping the crocodile, and he's doing pulse healing of a massive crocodile and helping him to overcome constipation. And so what better can explain the shlok and about compassion? So yeah, so this is a very good case study which says a lot from the picture. And crocodile is such an animal which is so scary, but sir is doing the pulse reading and helping him to overcome constipation and making him happy again. What can be a better example of compassion? Yes, next slide, please. And again here, our great madam, Dr. Smita Naram, madam. So she is doing the pulse healing of a python, and Dr. Pankaj Naram sir is observing. And again, a very good example. Like a picture speaks millions than words. So this picture speaks more about compassion for every living creature, even if it is dreadful and scary like this python. So she is helping the python to overcome the digestive disorders. So these two people have really we have showed us and led by example of what is compassion and how it can take you to great heights. So yes, a very good case study. Next slide, please. Now we move on towards another point of Prajnaparad. Now, what is Prajnaparad? It is the crimes against wisdom. We will understand it. Again, there is a shlok. Why we have put the shloks is because Acharya Vagbhata in the Ashtanga Hridaya has explained that these shlokas are like mantra. We do not need any other mantra. So recitation of these shlokas or listening to these shlokas itself is a mantra. धीधृति स्मृति विभ्रष्ट कर्म यत् कुरुते शुभम प्रज्ञापराधं तं विद्यात् सर्वदोष प्रकोपणम्. So what is Prajnaparad? A person whose intellect, patience and memory are impaired. Okay, so one whose all these three things are impaired, he subjects himself to Prajnaparad by virtue of his bad actions. So Prajnaparad is not something that we want. So it is something like a bad thing or not a good virtue. That's why it is called as the crimes against wisdom. And it leads to aggravation of all the three doshas. If we have to explain very easily, Prajnaparad is just opposite to Sadvrutta and Achar Rasayan. So opposite of Sadvrutta or opposite of Achar Rasayan is Prajnaparad, not going according to the code of conduct or good regimen or the behavioral rejuvenation medicine is Prajnaparad. And what it will do, why it is important? Because the Prajnaparad again leads to the aggravation of all the three doshas. That is very important. So when the doshas, all the three doshas are aggravated, there will be the occurrence of several kinds of serious disorders. That's why it is important that a person stays away from this Prajnaparad, and how that can be achieved is by maintaining a good intellect, having patience and good memory, means to understand and remember what are the good codes of conduct or the good regimen. So that is about Prajnaparad. Again, So pradnaparad is willfully ignoring one's inner knowing and going against the norms, intuition, and common sense. So there are general rules prescribed for everybody when we live in a home or a locality or a society or a nation, going against that, and that too willfully ignoring it. So that is pradnaparad, and it is the root cause of many health problems. It vitiates all the three doshas, and it involves the verbal, mental, or physical activities which are unfavorable to the self and harm both the body and the mind. Something that does not make anyone happy, not the person who is doing it or to whom he is doing it. Nobody is happy with that. So that behavior comes under pradnaparad. Then actions generated by pradnaparad aggravate three dosha, that is all the three doshas, and they stimulate the raja and tama doshas. So as soon as the raja and tama, that is a psychological attributes, they also become imbalanced. So it leads to several mental health issues as well as the physical health issues. So psychological as well as the physical health issues they develop. So it is not only about following the right kind of diet or following the right kind of lifestyle, but it is also about following the right kind of sadavritta and achar rasaya. So that is a very important factor. Next slide, please. And this pradnaparad, it leads to the most common disorders. Like here we can see a number of disorders, and most of them are lifestyle disorders, like hypertension, diabetes, diarrhea. It's a very good picture where there's so many disorders. And often we find that clients sometimes they say that we follow the right kind of diet and lifestyle, and we also have to advise them this, and it has to be done, of course, skillfully and not to offend anyone, but we have to learn how to advise these things skillfully to a person so that he inculcates that. And the best way is through stories, of great people, or reading books, or reading others, learning or knowing about others' experiences. So some are these ways are there, so we can know about that. Yes, next slide, please. And here again is a case study of a client, Kate Key. So she suffered from psoriasis on her palms for over 8 years, and her symptoms were very aggravated, so much that she developed cracks on her fingertips that were bleeding. So it was a really chronic condition and a very severe condition. So when she came to Ayushakti, the Ayushakti Vaidyas examined her and advised detox plan and herbal supplements like skin tonic, immuno, and a diet plan. When she followed everything in the first month, and she was 70% better, she felt better. And after the first month, she did not continue with her diet and lifestyle plan. Now see, as soon as she got some results, she felt that, okay, now it's better to skip the diet and everything what is recommended. So she stopped following it. And as soon as she stopped it, again the symptoms reoccurred. So the unhealthy food temptation was overpowering her. And this is a type of pradnaparad. So if we want to explain pradnaparad, this is a very good case study and a very good example. When we advise the clients to follow a certain kind of diet and lifestyle, we already tell them this is to be followed for say 6 to 8 months or for a year according to the condition. But as soon as some results are seen or some relief is seen, if the person just starts following again the wrong diet and lifestyle, it may only lead to increase in the disorder that he was facing, and that is called as pradnaparad. So it increased her symptoms again, and again we helped her to improve her strength of mind and decision making process. So pradnaparad can be avoided by increasing the strength of mind and improving the decision making process. And then she went off track a few more times, but finally she started again. She resumed her program and she continued with follow-up appointments, and she was monitored for, whether she was following Sadvrutta, Achar Rasayan, or whether she was avoiding Pradnaprad. And then her symptoms were very much under control and she's okay now. So here in this case study, we learn about how to help people to follow the Sadvrutta and Achar Rasayan, and also advise them to avoid the Pradnaprad. Pradnaprad means that which is opposite to the Achar Rasayan or Sadvrutta. That is not according to the lines of that principles of Sadvrutta. So this is a case study about that. Next slide, please. So yes, we come to the conclusion of this session. And again, we end this session with again a very important Sanskrit verse, which is Matirvarcha karma sukhanubandham satvam vidheyam vishada cha buddhi Jnanam tapas tatparata cha yoge yasyasti tam nanupatanti roga. So here, what this Sanskrit verse means is that an individual who is endowed with excellence of thoughts, speech and actions, right thinking, clear understanding, knowledge, observance of spiritual prescriptions, and love for meditation always remains healthy and happy. So this is the thing which is described. This is a verse from the Charaka Samhita. And again, we know that these are the things that are to be followed. But the thing is, sometimes it's difficult to follow, or sometimes it is difficult to stick to it. Sometimes it's like we follow it for some days or some months, and again back to that, like the client was doing, the psoriasis client was doing. But in that case, we have to just recollect and remember that we have to stick to these principles and learn to forgive. Even if we have decided to follow a certain good regimen, and if we are not able to follow it, there is no need to get disheartened. We should always forgive. We always talk about forgiving others, but we should also forgive the self. So forgive the self, and then it's okay that, okay, I've done something wrong. I know that, but let us stick. It's not like, no, I cannot do it. It's not for me. I'm just feeling in this. It's not like that. It's about forgiving. Okay, I have not done this. I will just do it another time, like that. So one thing to remember is it's easy to forgive others, but sometimes it is easy to forgive the self. And we should learn this, to forgive the self and to stick. And whatever we can follow and however we can become better and better, that is the main goal and that is the main motive of Sadvrutta, Achar Rasayan and today's session. So with this, I think the next slide. Yes, that will be done by, I think, Hemang sir or Cornelia. The challenge activity. Thank you very much.
Yeah, I can. Thank you so much, Dr. Kamal. As usual, a wonderful presentation. And now it's up to us. We have a challenge activity. And it is this month, follow the Sadvrutta for yourself during the next month. Observe the changes and write a summary about your results. And then second, advise the rules of Sadvrutta to a person for a month and observe and write a brief summary about their results. So that is our homework assignment or challenge activity. And you will also find it in the study material. That's the slide is there as well. So thank you again, Dr. Kamal. Wonderful presentation.
Yes, thank you, Dr. Kamal.
Thank you so much.
Thank you, everyone. Yes, Susie.
So I'm going to tell on myself here because this is how I learn. And I might cry because I'm 56 years old. And I just realized something really powerful. And And I have to say this in front of what I want to say. My parents did the best they could with what they knew how to be, right? Because they're just being who they are, right? And the best, and to keep it short, like I was a round person and my parents were two square people and they tried to chisel me into a square person. Like, and so I'm realizing that a lot of my things that are going on have to do with not being able to have been my own self growing up. Because they wanted me to be a certain way and me wanting to please them, that's what I did. And at the same time, as an adult now, I realize that some of the patterns that I have are in direct reaction to my experience with my parents. So I have some deeply rooted subconscious experiences in my body and in my mind and my emotions. They're deeply rooted. I don't even see them. And I'm reacting without self-discipline. I will show up for certain things and not show up for other things that sabotage my ability to provide for myself on a lot of levels. And the money issues are also directly related to my reaction to my parents. And I just put it together. For a Marma point to help me move through this, because I understand I don't have to do talk therapy. I don't have to spend years of processing this, but I would like to move it out of my body, mind, and spirit and emotions as quickly as possible. What Marma point could I use for this? Because this was a profoundly, answering those questions of self-evaluation were very beneficial. So thank you.
Susie, lots of love. Everyone is sending you a lot of love.
Thank you.
Appreciate you. It needs a lot of courage. It's not easy to take this ownership. Whatever is happening in our life, we are all responsible for everything. It is easy to blame this and that, him or her, but to take ownership and to make and to start working on that and to think about it needs a lot of courage. Your willingness to make changes is the first step towards the success. And for sure, you will have the big transformation. And maybe this day or today will be the day will change a lot of things in your life. Normally, people need only one point, one specific hit, like which can turn a lot of and make it a lot of make miracles. It's never late. Whenever we can start, whenever we realize, whenever we understand, we can it. The best marma, effective marma, is one and one simple marma. Yes, Jaina, you want to say? Which marma?
Yes, the what do you want, Marma? It's so powerful.
Yes. Do this marma and forgive and forget. We all need forgive and forget. We all need that marma. We all have the bright future waiting for us. Just because of some emotional trauma, grief, pain, we are blocked. Our energy, our potential is blocked. We are using only our 20% of strength. 80% of our potential we are unable to use because of this and that block. Our ego. Sometimes just because the ego, we are unable to do many things. But forgive and forget Marma helps to remove and heal and release all these obstacles, blocks. Something may have happened in the past. We don't want to stuck and stop there. Now it's high time to just move on. And it's a beautiful gift to this world from our lineage, that this Marma is helping and transforming and saving so many lives. Just forgive, just forget. Remember always that to press the point on the left side of the hand. Why left? Sometimes or many times, many of us not seeing or experiencing the positive change. And I have seen personally that we are doing Marma on our right side. So pressing the point on the left side is very important. Why left? Why left?
Heart.
Yes. Left is associated with heart, and heart is a place of emotions. We are working on the emotional trauma. And second reason is the left is a past, and we are working past. If by mistake we press the point on our right hand, we are carrying the emotional trauma effect. We are strengthening our emotional trauma effect. And then we say, I am doing this forgive and forget Marma from years, from months, from weeks, but I don't experience any positive change. No surprise, because we are doing on the right side. Just within the 7 days, you must see the change. One small change for sure. You start experiencing just within the 7 days. If it is to be done like a proper way, right way. We are doctors, but before doctors, we are human. We all can have some personal, professional, family, social challenges. We at Ayushakti doctors have a protocol. Before starting our OPD, our consultation, we must do this Marma every day. Because after forgive and forget only, we are able to connect and to associate with the client's pulse. Otherwise, we are also blocked. We may have some issues and we are unable to find the right things. We are unable to diagnose certain things. So do this Marma and experience the miracles. Good sharing, appreciate you, Susie. We love you. We are with you. And it's a good way to start taking ownership for anything happening in our life.
Thank you.
Good, good. Nice. Yes, Jaina. Maybe still you are mute.
You're just still muted.
Sorry.
Uh,
I have a question. First of all, Susie, thank you. There's so many people in this group that have really resonated with what you just said and what you just did. And thank you so much for that gift that you gave to us. I have a question on the challenge assignment. Cornelia. On the second part, it says that you need to recite those for 1 month to one person. I'm a bit confused. So do you take one person, recite them every day, or do you take?
It didn't say recite, it said advise. So you advise these rules and then they are supposed to follow those rules for months and you take note of that. That's how I understand it. Am I correct, Dr. Hemang?
Yes, very true. So the idea is, see, always we give one challenge activity for the practice purpose. So it helps to understand these concepts of every session. Every lesson, every session has some messages. And that message, that concept, we want like everyone understand properly at the deep level. And the best way is by doing. And that's the purpose. You advise one of this like these rules to one person. There are so many different segments and sessions in this today's lesson. So some rules you can suggest someone, someone. Then you observe the changes and you follow everything and observe and note down the changes, what's happening, and then share in the next meeting.
So would we be able to do it amongst each other, like with the people in our group, or do we need to be doing this with an outside person?
Any which way. It can be here in the group, it can be anywhere. It's always any person. You can find the one person and suggest and advise like to do this. First to ask what already the person is following, maybe out of 5 things, already following 3 things. Then to explain, okay, do these 2 more things for 1 month and to see an experience and then share your experience.
Okay, thank you.
Welcome. Nice, good point. I again request everyone, please, now or later, whenever you get an opportunity, make sure at least not 5 people. Many times we have recommended to do this challenge activity for 5 person with 5 people. Not able, at least 1 person. That will boost your confidence when you see the result with your own person, someone who is following, making changes in the home remedy or diet or lifestyle or whatever, something about today's session is very important. Otherwise, this knowledge will remain only in the computers, only in the study material. If you want to use, see, this group is really like a tomorrow's practitioner group. And we want that every one of you do your own practice by your own individual, independent practice. And for that, today is the right time to do practice. Yes, Apsana.
I just want to say thank you. When Susie was talking, I was crying because it kind of really touched my heart. Yes. And I am just so full of love, and I want to say a big thank you because since I started knowing Dr. Clint and the way that he changed me, so I'm very grateful to him, and Dr. Naram and everybody, all of you doctors, Dr. Kumar, Dr. Hemang, Dr. Mira, all the doctors, Dr. Smith, and all of my friends here, all my family here. I just, I was taking all the herbs, and I used to, like I always do, I do the herbs and whatever that I can do, the change of diet totally, and you know, talking to people about Ayush Shakti, about the treatments, etc., etc., etc. I remember translating the book, and I kept saying to Dr. Clint, your book is like an onion. It has many layers. As I translate and I proofread, I learn something else inside. Then I proofread again and I translate again and I find something else in it. And today's session kind of brought it home for me, because I was thinking this Siddha Veda, Ayurveda is treating us deeper and deeper and deeper. Now I understand what it means to be treated deeper and deeper, because you are reshaping what we are. We are also reshaping our future, our now, our being, the kind of a person, the kind of a human that we are, from loving animals to loving plants to loving each other. And I'm not just talking by just rubbing the hands and doing that. That has such a deep meaning. But to change what we eat, to change how we think, to change how we react, how we talk. My goodness, there is so much. This is deeper than the biggest tree root in the world, which I don't know where it is, but thank you. Thank you, thank you, thank you to everybody that is seriously kissing our heart in this way. I love you all so much, and I want to say thank you. And my biggest thank you to Dr. Clint for bringing me to this place. Thank you, thank you, thank you. I love you.
Thank you, Apsane, for sharing such a wonderful words, and like really, it's a great acknowledgement of this movement which has been started from last years. And truly say, it's like an onion. Every time you find something new, even if you read the same book or you read or watch the same session again and again, it is all depending on how you see, how do you read, and what kind of the message you want to receive. Every time something new, great. And it's a wonderful family that we can exchange and sharing our thoughts openly with the open mind. Nice. Thank you. Yes, Tamara.
I have a question about a patient. A practitioner called me last night and was talking about this patient who, it sounds so perfect for this session for today. She is, very articulate, intelligent woman. She's very, very stuck. She's in her 40s. She's an actress and very skilled, but really gets down on herself because she feels like she never goes out and sort of follows it or is able to do her passion or really follow her purpose. And she gets in these loops where she has a tremendous amount of rage and anger, and she'll try and bring that up. The minute she gets angry, though, then she dives down into deep sort of shame, despair, gets in these very deep, sobbing, despairing, emotional collapse places. And then from there, this very strong critic comes in that just attacks her, like very judgmental and, how terrible she is. And so she gets in this constant loop. And I mean, from the Ayurvedic side, it seems like, so this is part of what we're talking about today, but also maybe part of the suppressible urges, so it seems like it's a combination of these two. But I'm just wondering, she's tried everything. I mean, she's been in therapy for years. She's tried, emoting more, and she's tried all kinds of things. I think she's been, trying to deal with this for probably 20 years. And this person, this practitioner she came to, is able to really hold a deeply loving space and let her just be in that space. And I think that's why she's just returned back to her. I'm just wondering, how might you introduce this or approach this, or what's the entry point for someone who's so caught in that and really can't find the way out. It's like she can't, it's very difficult for her to hang on to anything positive. And she also, it's very difficult for her and probably uncomfortable and maybe unsafe for her to feel anything in her body. So going into a positive body sensation doesn't work. She can't go there yet.
Good. Most of the time, this reason for this kind of the anger, frustration, irritation is some another type of the emotional trauma.
Yeah.
Some frustration. Always, again, it's difficult to suggest him or her all this philosophy in the first session. It's difficult to ask or suggest or start to do this and that, to follow this and that disciplines. First of all, need to give some positive experience easy way. Begin with forgive and forget. Emotional support murmur will change the vibration in her mind, and along with that, to give bliss. Bliss, 2 tablets 2 times, and heart tone 2 tablets 2 times. After a month, to review the condition and to see what's the difference. If you see that, and if she experiencing some positive change, immediately you can take her to the next level. Step by step, everything will wash out. Everything she will forget, and there won't be any more anger, only love, love, love.
Beautiful. Thank you very much.
I would like to call on, thank you.
Yeah.
I would like to call on Sankita because she had raised her hand and got kicked out, but now she's back. So Sankita first, and then we still have Alicia and Deborah. Sankita, can you
Thank
unmute
you.
yourself?
Thank you so much. Namaste, Dr. Hemang, and namaste,
Namaste.
everyone.
Namaste.
My question is about the forgive and forget marma. So last year during the 100-year course, we had this ceremony about around forgive and forget, and that was during the holy time as well, and it was doing the forgive and forget marma, and then letting go of what is not serving you. And so at that time, I myself was going through a guilt for it had been for a while, and then what came in the frame was I myself not being able to forgive myself. And in that moment, I just felt on my knees, and it was like I cried so much of emotion was coming. But after that, it was with Dr. Naram's blessing, it was so beautiful and serene, and I could feel that guilt was coming out of my body. So, and since then, like I had been doing the forgive and forget marma once not on a regular basis, but now recently I've been doing that as a part of a daily practice. And there was a time when you press the points, there were points where you could feel the pain, and then there was a time when the pain was no more. But recently what I found is there was a time when there was no pain, but I found that the pains are like in more deeper level, the pain is coming. So when I press, so it is there. I mean, so is it like when we are doing these marmas, so it's kind of, is it the deeper and deeper levels of pain is kind of surfacing and you're able to kind of let that go? Is that how it happens? I just want, that was my question. Thank you so much.
Exactly. Exactly. It is kind of like one after another layer you are clearing, and then the deeper level trauma or deep effect is coming. So in between there is nothing, and then again starts. Is a one most commonly happens, but at the same time also possible that this pain is coming from the new trauma, something new thing happened in the life. Earlier everything was finished. So sometimes it is, yes, possible to find out it's a new or old, or sometimes not. But as the name of the marma and the purpose of the marma, forgive and forget. So no need to understand whether it is a new or old. Anyway, we want to forget it. Not important at all. Whatever it is, let it be. We want to throw.
Thank you so much, Dr. Hemant. Thank you.
Good, good. Thank you. Nice. Yes.
Alicia?
Yes, hi. So I'm glad we're talking about this because it's something that I've been wondering about for a while. When it comes to learning the marmas, I've only learned a few, and when suggesting them to people, I don't have a very clear, because I don't have so much experience with it, I don't have a very clear explanation or diagram to follow. And I was just wondering if there is a reference that's easily accessible, even for my learning, but also to share with other people, or if there's some specific protocol, because it's like recipes, right? There's a specific formula for certain things, like you were explaining with the depression, for example. There's a combination of the herbal supplements and the marmas, and how many times to do them throughout the day. It would be nice to have that a visible protocol to reveal to people. Maybe it could be included in the recipe book, or I don't know if it's something I would imagine we're meant to learn gradually as we go through the course, and it'll become more clear to us. But when helping people at this stage, I feel a little bit lost. Like I don't know exactly where to guide them to, or YouTube videos, whatever. It would be nice to have some sort of very clear understanding of what that is.
Yeah. So your understanding is perfect, that step by step in this 3 years education we will cover and talk everything, and that is the purpose. So right now we are like sometimes talking about diet, sometimes marma, sometimes herbs, and then in the like a later next year we will have everything together, condition by condition. Like if there is a person with the condition of the arthritis, or person coming with the anxiety, a person is coming with the panic condition, panic disorder, a person is with the asthma, what to do, what the complete the protocol, treatment protocol should be, that will be there. Right now we are taking in the part.
Sure. Yeah. I don't want to rush. I'm just trying to,
Yes,
if I want to help
yes.
people at this stage, I feel a little like I'm fumbling, but yeah.
Yes. Right now what all you can do, yes, time to time when you have someone, you can note down the history, medical condition, the client condition, and share it with your mentor. Mentor will guide you what exactly to do with this. If client is agree, the person is agree, arrange or schedule his or her appointment with your mentor. and in the call you understand. Or if not agree, you just receive the information and you pass on. And not only pass on, but read it, understand it, ask the question to your mentor, why this, what is this, what happens, how it works. Time to time, right now, to go like this, and then later, for sure, you will have all understanding. And as like just few minutes before I mentioned, that we want you all to do practice individually, independently. You will not need any support from us. We will make sure. And you will do it without reading the book, and like not the client is coming and you search on the portal. No, everything with your confidence and your knowledge and skill.
Brilliant. Thank you so much.
Good.
I have one more quick question, just about, for example, in the course, in the lecture, the example came up of illnesses that come from wrong conduct, right, or wrong thoughts, or what happens when you encounter someone who feels there are elements of their life circumstances that may be contributing to their illness, but they feel they cannot change? Like, for example, they're in a life circumstance which, like, they're not actively, for example, they're eating well, they feel that they're active, they feel like they're doing a lot of things right, but if they have, I mean, I can imagine advising someone in that case to do the forgive and forget marma, or to, practice, meditation or self-care. Yeah. But if they're in a life circumstance, they feel they can't change and they feel that's contributing to their illness, how would you advise them?
Yeah. So the whole idea is to live in the circumstances which are there and to find the best possible option. So if I give you one simple example of last 2 years, pandemic. Before pandemic, we never thought that we can do so many different things through online. We learned it. When situation or circumstances happened, came in front of us, no choice, no option. Our mind started working on, thinking on what are the possibilities. How can we do still this and that? Similarly, whatever the options are available, circumstances, we at limited extent we can work and change. If someone has no food, yeah, we may help at some extent. If someone has no house, we may help or we may not help. So as an ideal lifestyle, as an ideal food habit to follow, they need something. But sometimes it is possible, sometimes not. But still, to find the best possible way and option, whatever the circumstances are there. So sometimes, I give you one example that we tell that people avoid this in the food diet, okay? But at the same time, we mention that to follow this recommendation whenever and wherever there is a possibility, options. Sometimes you are at the place when you don't have the choice. You don't have the right food, what you are supposed to eat. Then eat what you get. Then you forget Ayushakti Vaidyas. Enjoy your life. Just relax. So to stay and live the practical way, total practical approach is the best living. Yes, when there is a possibility not to eat the food which you are not supposed to eat. Similarly here, whatever the best possible, like a possibility, according to the circumstances that we can do, right. Nothing more. We cannot do beyond that.
So just simply live your life and find contentment and be open to the answers, the options for a better situation, and go for it when it presents itself.
Exactly.
Yes.
Yeah.
All right. Thank you.
Welcome. Good.
Deborah?
Okay, first of all, I want to thank Dr. Kamal. I was so excited to see that she added the herbs to the case studies today. And in response to one of the other questions that was asked today, is there a possibility that you could add specific marmas that you say marma as an option for those patients, but you don't say what type of marmas they were prescribed? So maybe in the case studies, we could say what type of marmas would be a possibility also. But thank you. I did notice a difference and it was very helpful.
Yes. Every one of you, the suggestion which we received definitely is useful.
Yes. And then the second question is regarding the patient you were discussing a little bit ago that was having that very destructive loop and had the anger. And I understood why you would prescribe bliss, but I was confused why you chose heart tone. I understand that heart tone, that heart dharmas for fear, because fear is in the body, the fight or flight and the blood pressure and heart rate. But why did you choose heart tone for her anger and her destructive loop?
Good question. Good question. So again, the reason behind the anger is some emotional trauma at the deep level. And to heal that emotional trauma, heart tone is very useful. For any emotional condition, any emotional situation, heart tone is very helpful. Because heart tone is not only for the heart condition, physical heart, but it's beyond. Sometimes due to maybe, I don't know, someone of you or maybe some of your clients, you may have seen that the Ayurveda Vaidya recommended them heart tone in the condition of panic disorder, palpitation, restlessness, anxiety, depression. Along with bliss is very useful. Bliss is more calming, cooling, chilling the mind, relaxing, grounding. And Brainto is more for functioning.
Oh, yes.
Functioning means memory, sharpness, intelligence, focus, concentration. So according to this situation, more useful combination is bliss and heart.
That was very helpful. Very, very helpful. Thank you.
Welcome. Good question. And for sure, we'll mention more specific name of marma from the next time. Maybe not next time, because next time material is already ready. So after that, name of marma we will. Okay.
May I ask a question, Dr. Hemang?
Yes, please. Please.
Would the Sank Mudra help with those emotional issues?
Sorry, say again.
With the Sank Mudra?
Yeah, Sankha Mudra. Yeah.
Yeah,
Helpful.
would it help with emotional issues?
Yes.
Thank you.
Yes. Good. Yes.
We have Jana, you have your hand raised.
Yes, this is a little bit off of the topic, though I've loved this topic and I love those herbs. I love the brain too. I love the bliss. I love the heart tone. So if you guys ever want somebody to talk to about who has experienced them, I'm happy to do that. But I've had someone ask me if they could see Dr. Priyanka's video that they did, and I didn't know how we could share those. How can we share the Vaidya's videos with the people that we would like to share them with?
Yeah, I think the link is shared in the group, and the same link you can just forward.
Okay, so
Just
is
simple.
that connected to the Google Drive? It's not a YouTube video?
No.
Okay, so it's a Google Drive. Okay,
Google
great.
Drive. Yeah. So this webinar for the people which we had for the each path group, they are available. All these recordings are available on the portal as well as in the Google Drive. So link
So
of the Google Drive, we have said in the group wise, in the path group, each and every group, those link you can share with your people, your contacts, your friends, wherever you want.
okay, so they are available. They're able to be viewed by people who are not in our group.
Yeah, from the Google Drive, not
The Google Drive.
not from the portal. Portal is only for us.
Right.
But
Okay.
we have this webinar available on two different side, Google Drive as well as on the portal. We have available here and also here.
Wonderful. Okay. Thank you so much.
Good. Welcome. Good question. And we have still two more webinar. One on this Tuesday night from the Dr. Neetu, and the next Friday by Dr. Ketki Madam on this Friday. So 2 times. So I think the Tuesday is something at night time, evening Pacific time. And the Friday is again the morning Pacific time. Yes, yes, good, Robin.
Yes, the same friend I was mentioning, I was teaching the forgive and forget. Then I told her about the what do you want, and then what do you get when you, or what does it look like when you get what you want? And I heard it as the first knuckle, but I couldn't see it particularly. And she was thinking the first knuckle was next to the tip, and I was thinking the first knuckle was next to the base of the palm, but I had needed to get clarification, and now I really need to get clarification because I told somebody about it. And would you be pressing the sides or the front and back?
Sides.
Sides. And is it the first knuckle close to the base?
Close to base. Exactly.
Okay. All right. Thank you.
Good. Good. Nice. Good session, good question, good connection, involvement. Best. We don't want to stop this. So
One other question we
please.
had talked about whether or not we would have a Q&A on the Memorial Day weekend. And so do we know if we're doing one next weekend or not?
Good question. So actually, because the long weekend specifically in US, it's a big holidays, and so we have not kept any official session the next Saturday. So since we have started our education like from 15th of January, every Saturday we are meeting and talking. So first time it's officially off, officially break. But we have the other special session for our other group. And but we all are invited for that. If we have like a time and possibility, will be at the same time the Saturday, again 8:30 a.m. Pacific time. And especially it will be by Dr. Tom Mitchell from US, North Carolina. He is going to share many different case studies, how he treated, how he is helping to the arthritis people, asthma, skin person, anxiety, ADHD child, autistic, all different condition, what kind of the treatment protocol he is following and doing, and what kind of the result he is getting. He will share with us all this detail. So we all are like welcome to join that session. But only the thing to remember, we will not use this education portal for that. We have the separate, we will have the separate link for that. So whichever the link that we will share in the group of our 3 years path group, and from there you can join it. That session won't be available on this education portal. That session, maybe we will definitely record it, but we will share through the Google Drive. So you can all, like who will miss to attend it live session, can watch it later. The next Saturday, and the Q&A session, maybe we will plan it, schedule it in the month of June somewhere, but first Saturday of the June, we have the education session. Then the second is a mentor meeting. Third is again education. Now in the month of June, we have planned the review of all 6 months. What we have learned through, all gone through everything, every session. So we will have the session on the 18th, I think, yeah, 18th of June. The revision of everything. So maybe it's good to attend, where you will have the opportunity to go through the everything from the day one, from the session 1 to end. And then still we have the last Saturday of June left. So if nothing comes in between, then we will organize the special Q&A session for that in that schedule. But otherwise, you can ask the questions. You can like to mentor anytime in your group or common group. We will try to organize this session in the last Saturday of the June. Anything from anyone? Anything? Any questions? Thank you.
It sounds like a
Thank
great
you.
plan to me. I'm sure that everybody feels the same way. It's a really great plan. Thank you.
Thank you. Thank you. Thank you. Thank you. Thank you. Yeah. No. No, I am not coming to UK. Dr. Smita is visiting there. I'm going to Europe. So next month I am traveling to there, Europe again, and then yeah. Also Dr. Ronak is traveling to Europe. Maybe Dr. Priyanka is traveling to US. Then Dr. Aswini Porate and Dr. Pranav and all the doctors will go in their area, in that part. So they will have more opportunity to meet you in person, more personal contact, more personal bonding. You can like be there wherever they are. You can go there and learn more personally by being in the OPD, sitting with them, observing the clients. Maybe yeah, if you have possibility, you can invite them to your place and like to see the clients, and then they can go. They can come only for a few hours there, seeing the client and go. So now in this month and next month, people, most of that mentors are like us, they will start traveling here and there. Already few plans are already there, and some we are in the process. Thank you. Thank you. Thank you. Yes. Thanks
Thank
a
you
lot.
so much.
Thank you.
Can we rub our
Thank
hands
you.
together and
Yes.
say, I love you and I'm with you?
I
We
love
love
you
you and with you.
Love you and I'm with you.
Absolutely.
And I'm with you.
And love with you.
And I'm with you.
I love you.
Thank you.
Thank you.
Thank
Thank
you.
you. Thank
Thank you.
Love you and I'm with you. Thank you
Thank
so
you.
much.
Thank you, everyone.
Thank you.
So healing today. Thank you.
Thank you. Love
Thank
you,
you.
Miss Susie.
Love you.